the grant submission, and then understanding the review criteria. What would the reviewers be looking at specifically when they are evaluating your proposals? And what are the types of information that you need to make sure that you include in the application to fulfill those requirements? Okay. When we think about a successful grant application, it has three components. The first is a very strong and innovative and new idea. The second component is strong methodological approach. And the third is the putting together the strong grant application itself so that you can demonstrate all that you're planning to do in a way that meets the grant application criteria. So these are the three key foundational pieces to a successful grant application: idea, science, and then preparation of the application. So let's first start with a strong idea. All programs of research start, and all grant applications start with a single goal of either understanding or fixing a health-related problem in nursing. And as we know, many problems have many contributing factors, as well as many potential solutions for understanding how possible for any one researcher to understand all the factors that contribute to a particular problem. So for example, if we're interested in obesity and diabetes, there are so many different contributing factors. There are so many issues related to treatment, medication adherence, health promotion, medication and non-medication strategies for management, that is impossible for one researcher to have all the relative expertise. So that's why although we may share a common research problem or health problem, we may approach it from very, very different perspectives than our colleagues. And that's a positive thing because we want to be expanding our understanding and contributing to the literature. So when we think about the problem, where we decide to focus our attention on the problem depends on how much prior work has been conducted. Every problem, as we learn, every health problem has a progression of research that is instrumental in understanding and addressing the problems. The first step in any research problem is understanding prevalence. How often does the problem occur? Many issues that are and health problems that are newly emerging will look at issues of prevalence. Also, we may look at issues of prevalence in response to interventions. So even though we may have prior data on prevalence, we may be looking at the impact of a public health policy or a change in practice in terms of looking at changes in prevalence over time. The second area that we think about in that progression of knowledge for how to improve health outcomes is to understand who is more likely to experience the problem. Here we know that there are populations that are at greater risk for specific problems based on age, based on gender. And then we know that there are populations that are at risk for health disparities due to minority status or poor access to care, such as rural environments. So then the second primary focus of research is to better understand, if we know how often the problem is occurring, then our next step is who are the people who are more likely to experience this problem. Following that research, the next step in the progression of research is to understand what are the mechanisms or the causal pathways, or more simply put, what are the risk factors for that health problem? And do those risk factors vary based on different demographic groups? So a basic risk factor might be health literacy for understanding, for improving health, medication adherence or self-management. But a unique risk factor may be experiences of discrimination in the healthcare environment, um, based on some social category. So there are universal risk factors that we can identify, but then there are also population specific or unique risk factors that also need to be identified. And then finally, after we understand how often, who is more likely to experience it, and what are the risk factors, now we can start the processes of intervention development. And where you focus your own research is very much related to how much information on that topic is already known. So when we're thinking about the final steps of the problem, and that's developing interventions, there's even a lot of diversity in the way that we think about interventions. Some interventions are focused on prevention. How do we prevent obesity from happening? Others may be focusing on the treatment and management of obesity and obesity-related disorders such as diabetes. And then finally, there may be intervention research that are focusing on reducing recurrence of a disorder. So for example, if a patient has lost significant amount of weight, we all know that many people often regain this weight. And so some interventions are focusing on reducing relapse or recurrence or a new occurrence of a disorder. So even our interventions can focus on different aspects of the nursing responses, prevention, treatments, management, and there are multiple levels of intervention that can be thought about. There might be levels of interventions that are focused on the individual, the community, or clinic level, school level, or organizational level, or even policy level. So when we think about any given area of problem, there is so many opportunities for new and innovative research. The goal is to very clearly understand the literature and identifying gaps in which you would like to focus your work. So as we think about the problem that we're interested in, one of the factors that increases the success that you'll be funded to conduct further research is demonstration that you have expertise in an area. Expertise is demonstrated by a track record of specific focus on that problem area and multiple publications that start to demonstrate your experience and ability to conduct research in this area. But many of us ask ourselves the question, well, I'm interested in so many different things. How do I define and do I decide where I should focus my interest? So there are lots of ways that we can think about this. The first is to think about, what is it that you love to do? Some of us came to nursing due to experiences that we've had either as children or based on experiences of our family members that led us into nursing. Others of us develop a passion for a particular clinical area based on our training and experiences. So one of the things that I really recommend is to choose an area in which you have a great deal of interest and passion as one way of starting. The second area in which we can think about how to develop what problem we can address relates to our clinical practice. Every day, nurses see multiple problems within the clinical practice setting. Even though we may have clinical practice guidelines, we still see problems with implementation. We see problems with appropriate assessment, and we see problems with cost associated with the strategies that we're using. In addition, we may see problems with the patients that routinely have difficulty finding success using standard interventions. And so our nursing practice can often tell us where the problems are, what work needs to be further understood. The next area is in terms of finding and identifying a problem area that you're interested in, is to focus on what are the national or international health priorities that are causing the most problems in terms of impact on the population, both nationally and internationally.
Yeah.
And what is the government and the World Health Organization interested in funding? In the United States, there's a lot of interest in funding chronic diseases based on non-communicable diseases. There's a lot of interest in funding related to mental health, substance abuse, and aging population, since our country, as well in the United States, as well as many other countries, are facing an aging population. And we need to better understand healthy living in community, issues that are at higher rates among the elderly, such as dementia and frailty. And we need to better understand how to provide those types of supports. So this is another way of understanding. So based on your identifying a project area, your passion, the um, the priorities of the health of the government, what you're seeing in your clinical practice, and also extending the work that your advisor is doing. Again, there are a lot of benefits of building on the established research of your advisor, because many of the problems, such as in terms of measurement, methodology, and recruitment, have already been well established. So you get the benefit of building on a program of research that is already evidence-based, and that you can start to extend it by asking new questions, and by working on new applications. For example, including technology, focusing on a new population in terms of older or younger, or an immigrant population, or thinking about if this research has been conducted primarily in cancer patients, looking at quality of life, ways to improve caregiver support and quality of life, might this same technique or approach also be appropriate for another chronic disease, such as care providers for dementia patients, or people who have advanced renal disease, or people who have advanced cardiovascular disease? So your advisor may have a program of research that's focused on improving caregiver supports in cancer, but you can use those same paradigms, that same approach, and do the preliminary research that's needed to adapt those same procedures to a new clinical population. That is a very effective way of advancing your career, especially towards interventions. Okay. So those are the primary ways in which we can start to identify the main problem. That's how one of the first thing that you do when you're trying to decide, should I continue in this area? Is it identified as a significant area? The second relates to innovation. Are your ideas about your problem you want to focus on and the research questions that you're interested in, are they innovative? Now, many people equate innovation with technology, and that is not necessarily the case. When we talk about innovation, we're talking about, is this area of research or the question that you're asking, is it going to advance knowledge in a particular area? Now, we can advance knowledge by addressing gaps in the literature, by focusing on health disparity populations, by introducing a new theory or a methodological approach, or a new measurement approach. All of those types of issues are ways in which we can introduce innovation. And then finally, is it relevant either for the nursing profession, for your government, and equally important, the institutions where you hope to someday get be hired to work? Okay, so first step, strong idea. Second step, and most important step, strong science. When we think about putting together a grant application that has a strong scientific premise, it must be very clear and logical that the problem area that you identify is you've identified a theory or key conceptual framework or construct that allows you to better understand the problem, and that you have developed research questions that address a gap in the literature and or novel, and that the main outcomes of your approach are all related to but either better understanding or fixing or intervening on the problem area. So each of your applications, when you think about it conceptually, there needs to be a very straightforward and strong connection between the problem, the theory that you've identified to help understand that problem, the research question that addresses a gap, and the findings. How will those findings from your study impact the problem area? Within that, there are a lot of questions that need to be answered related to your approach. And that relates to increasing the rigor or the strength of the methodological approaches that you use. The most important area of your grant application, the most important area of your dissertation topic, the most important aspect of the publication article that you hope to submit for publication in a Q1 journal is to have very strong methods. Has been a problem in the field, in the scientific literature, that there's a lot of research that's been published that is of relatively low quality. And we have the National Institutes of Health and other national organizations have really focused on, we need to have standards in place for how we evaluate the quality of research that's being conducted, funded, and published. Why? Because the quality of the research impacts how valid and trustworthy those results are. And it's important so that we can trust the results when we think about advances in evidence-based practice, changing practice at the clinical practice or the community areas. So we want to know that if we're making a change in clinical practice, that the results are evidence-based and based on the strongest science and results possible. So there have been developed a number of tools that help us to evaluate the quality of different experimental designs, both from qualitative research, descriptive correlational research, as well as different experimental designs, such as quasi-experimental and randomized clinical trials. These appraisal tools highlight some of the key issues that are associated with bias within this type of methodology. By understanding the most common sources of bias, we're able to design our studies in a way that helps to protect against those sources of bias and helps us to control for them or understand how they might impact our results if we're not able to address them within our design. So in addition to a rigorous research design, we're interested in rigor in our measurement approaches. That means we use standardized measures, not measures that are just created for your particular study, but ones that have been systematically developed, validated, and approved in the scientific literature. We also need to keep in mind as we think about outcome measurements, whether or not self-reports or a validated, more objective measure is required. Some outcomes are the only way that we can obtain them is via self-report. But in most cases, there is also a tool to obtain an objective measure. So for example, if I'm interested in studying mental health, there is patient self-reports of reporting on their symptoms, how much low mood are they feeling, how much hopelessness are they feeling. That's self-reports. But then we have validated instruments and assessment criteria that allow us to establish objective measures in the level of depression as well as changes in depression over time. That this is specifically true when we're looking at measuring behaviors that are related to health promotion, such as physical activity, smoking cessation, medication adherence. Those are dietary practices. We want self-report is not sufficient as an objective measure of an outcome of an intervention. Subjective measures, self-reports are just fine in survey research. But if you're doing an objective measure looking at an intervention or the impact of an evidence-based approach in a clinical practice setting, we very much need an objective measure. The next thing is when think about our data collection procedures, we want to have a good fidelity. That means a strict adherence to the protocol. This is especially true if you have more than one person who is delivering the intervention, or if you have more than one data collection or intervention site. So for example, if I'm working with 10 clinics, and 10 different intervention nurses, I have to be careful that all of those 10 nurses are adequately trained and that at each step they're following the protocol so that we can be assured that any differences that we observe between the clinics have to do with the intervention versus the control outcomes and not differences in how well the nurse delivered the intervention. So fidelity is a key issue. And then thinking about your statistical analysis, specifically sample size calculation. So there are a number of issues, areas in which we need to be very, very mindful as we are dealing with our research design. The third step is putting together a strong application. What do I mean by a strong application? The grant development strategy has, in terms of putting together your applications, has three components: the planning phase, the actual thinking, developmental phase, and then finally the writing phase. Let's look at our planning first. Preparing a strong grant application takes time. And many people really underestimate how much time it takes to put together a large grant application, because as you can understand from our discussion of approaches, there are many different things to consider as we're thinking about improving the rigor. So the first part of the application is really the planning phase. Then writing, and then the submission phase. So it usually takes on average 6 to 8 months from start to finish to develop a very strong application, especially if it's your first one. One of the things that we think about in the thinking, in the planning aspect of it is first we identify what is going to be the source of the funding that we will apply for. There are many, many different potential sources of funding, including the international grants, national government grants, foundations, university or departmental grants, or even industry or drug companies. They are also very much involved in funding research, both medication trials, device evaluation, as well as behavioral research studies. So industry can be also an important area to receive your funding. After you've decided where you want to obtain your funding from, then it's important to do your homework about the funding agency. Now, what do I mean by that? Not all funders are a good fit for every single study. So there's a number of questions that we need to ask ourselves. The first is, what is the mission of that funding area, agency? What is it that they're interested in funding? So you will find that information usually on their website and in their mission statement. They will specifically say that we are interested in funding research that address these following issues. The second thing that you want to understand from the funding agency is, who will they fund? Sometimes funders have restrictions based on type of degree, based on discipline, and based on institution types. So there are some funders that are most interested in funding early stage investigators, those investigators that are within the first 10 years of their finishing their PhD. These funders are interested in helping to support the next generation of researchers. Others are interested in funding research that is more biomedical. Others are interested in focusing on health disparities or chronic diseases or communicable diseases. It all depends on what the mission is and what type of person that they're interested in funding. The third question is, what will they fund? Will they fund developmental research? Or they're only looking at randomized clinical trials? Or are they only interested in secondary data analysis? So see, what are they interested, what types of applications are appropriate? And then finally, how much money do they have? And how many people do they expect to fund each year or each funding cycle? Some funders have a very limited budget, and maybe they will only fund 1 or 2 applications per year. It is a good idea to avoid those funders because it would be very, very competitive to receive a grant if they're only planning to fund 1 or 2. Unless you're very highly specialized in that area and your prior research is a perfect match for what they want to fund, then that's fine. You will be competitive. I try to tell most folks, though, to go apply for funding agencies that have a bigger um, um, pot of money that they're able to award, and that they're interested in funding at least 10 to 15 applications each time. That means that you will have a better chance of being funded. There's also something I want to point out, the difference between uh, a program announcement and then a request for specific applications. So a program announcement is typically an area that the funding agency is interested in supporting for the next 5 years. So for several cycles across a 5-year period of time, they will be interested in funding projects in this area. So that gives you the benefit of that is that if you submit the application and you're not funded on that first attempt, you can use the feedback from the reviewers that you received in order to revise and resubmit your application. Many funders will allow you to revise and resubmit 2 to 3 times. That's for a program announcement. Now, for a request for special projects, this is usually a one-time opportunity. So if you apply for that and you're not awarded, you do not get an opportunity for resubmission. So again, sometimes these special calls are a great opportunity, especially if your research and your prior experiences have positioned you extremely well. But if it's not a perfect match with your research, then it's important for you to be a little bit careful about that. Okay. I'm just I'll pause here to see if there are any questions that you'd like to add to the chat or like to come off mute and ask. Feel free to ask questions along the way. Okay. After you've identified what funding agency and which specific call for applications or program program announcements, the next step is to download the grant application instructions. Usually these are extremely detailed and must be followed exactly, else you run the risk of having your application rejected. So some grant organizations, if you make a mistake in the application, they do not give you an opportunity to, they will not forward the application for review. They will reject it. So you must be very careful, read each of the instructions extremely carefully. Next, as a part of the planning team, you've got your idea, you understand what funding agency you're going to apply to, you've gotten the grant application. Now it's time to put together your research team. This is a very important aspect of your research component because it's a key section in which the grants are evaluated. You're evaluated on the expertise. Several things when they look at your team. Are looking at the training and expertise of the principal and investigator. They are interested in the expertise of your co-investigators or consultants who are on the team. They want to see that every aspect of your grant application, there is someone on your team, either yourself as the principal investigator or one of your team members that has expertise in that area. So they'll look at the training of the principal investigator. They'll look at the expertise of the team, and then they will be interested in looking at have these investigators, has this team worked together before? And if so, what are their preliminary findings? What publications or work have they submitted together before? And what level of support do they have from the institution? So when we think about this collaborative history and putting together a team, many new investigators will not have prior experience with working together with their team members. That's okay, but you need to point out in your application that this is a new team that is being constructed because together they're working on a new area of research. However, each of the team members has the expertise to conduct the research, but this is a new group that's answering new questions. And most reviewers will be fine with that. They just want to know, do you have the expertise? So when you're thinking about your team, there are a minimum of 5 team members, either co-investigators, key personnel, or consultants. You will need someone who has the content expertise, that is an expert on that health problem areas, such as diabetes. That's typically the principal investigator, but not always. You want to have someone on your team that has methodological expertise. So whatever methodological approach that you're working on, that you're proposing, someone on your team has to have prior training and expertise and several publications using that method, whether it's qualitative, whether it's secondary data analysis, whether it's um, using electronic health records, or even cross-sectional descriptive. Again, each of those types of methods are fine, but you need to have someone who has methodological expertise. The third and critically important person is the statistician. Most grants that are funded by the National Institutes of Health in the United States has a separate statistician as a co-investigator on the team. Why? Because one of the many of the problems associated with the rigor of a research study relate to issues of measurement, power, and statistical analysis. And so you need someone on your team, not just someone who has 1 or 2 classes, but no, someone who is trained specifically as a biostatistician. The fourth area is someone who understands the clinical population, someone who works specifically with cancer patients or diabetes, patients with diabetes, and then finally someone who has expertise in community engagement. Either they understand recruitment, retention, or they work with a community-based organization that serves the target population, or it's a community-based organization that provides health promotion related to that disease and outside of the clinic setting and more in on a community focus. This is by and large the team that you will need. Be careful in trying to cover each of these areas with consultants. It typically is reviewed very poorly if most of your team is not a co-investigator, but is only a consultant. Consultants are usually very, 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 1 or 2 consultants, very, very high level of expertise that are brought on to provide overall guidance for the research, validity in general. So they expect team members to serve as co-investigators. Okay. When you are demonstrating the expertise of your team, usually there is a statement of the expertise of the collaborators, or often there's a requirement for a separate bio sketch. A biosketch is required for all NIH, National Institutes of Health grants. And it is a 5-page document that's highly structured, that provides information about, in a very systematic way, that provides information about the applicants, the investigators' training, their personal statement about their expertise, the type of research, their contributions to science, including peer-reviewed publications, right? This is different for each of the investigators on the team. Why? Because each of us will have different training and expertise and publications. So each investigator, and oftentimes consultants, will have their own biographical sketch. When we put together the biographical sketch, we want to make sure that it's just not a generic biographical sketch. sometimes very consultants or sometimes very busy and senior investigators will just give you a bio sketch or their description from another project. And that is usually identified as a problem by the reviewers. Instead, they want to see the information that's included in the biosketch specifically tailored to the type of study that you're proposing. So if I'm talking about, if you're doing a study on health disparities and community engagement and the development of culturally targeted interventions, and that's one of my roles on the study, I will describe my expertise in each of those areas. I will specifically state what role I will play in the study in regards to those areas, and I will add prior research, funding, or publications that demonstrate I indeed am an expert in that area. So you will ask your team members to tailor their biographical sketch to the specific study. In addition, when you're writing your application and when you're developing your bio sketches, you want each of the investigators to identify what aim of the study or what aspect of the study methodology that they will be working on. So every person who's listed on the study should it should be clear what research aim that they're contributing to, or what's methodological strategy that they are contributing to. I think I had a table for that. Maybe it comes a little bit later. Okay, so again, it should not be generic. It should be targeted to the focal point of the application, and it should be clear what each of the investigators will be working on. And then finally, it's important to have evidence that you have institutional support for your work. Often that comes as a letter from your dean or from your university. But also it can include letters of supports from community-based organizations as well. So if a major focal point of my research is to work with a community health clinic. So for example, I've done work back in Chicago with Howard Brown Health Center. They are a community-based clinic that serves LGBT populations. I list them as a collaborating site. I describe that site as where the intervention will be delivered, but I also need to have a letter of support that from the organization that says, yes, we agree to this study, we agree to have the intervention or the research conducted here, and you have our full support. If you propose to use an organization or some resource and you do not have a letter of support, then the reviewers question the feasibility of your study. Why? Because they say, oh, there's no evidence that that organization or that specific center has agreed to work with you. So you also always need that from your outside organizations and any consultants that you are inviting to the study. Letters of support are important. So how do you build your team? The first advice is to work with faculty in your own department or institution. It is really valuable for team-based sciences to in departments and schools of nursing to work collaboratively, to work on one another's research proposals, especially if they have the relevant expertise. Again, either you may not share the same content, but they might have a methodological or a measurement or a recruitment strategy that's appropriate for your research. This increases the funding, the percentage of your faculty that are funded. So if I'm working with Ajahn Periot, he and I are included on one another's grants. One, I may be principal investigator, and then I include him as a co-investigator, and then he may be the principal investigator and include me as a consultant or a co-investigator. I contribute to the success of his project, and he contributes to mine. And now both, instead of us each having one study, one grant application, now we are involved in two grant applications, and we can elevate our status as researchers, but we also elevate the expertise and the reputation of the department as highly funded departments. This happens quite often at UIC, and I also see the same pattern at Columbia University. It is a very strong recommendation members. Also, it may be a requirement that you do not have all of the expertise within your unit to conduct the study. So then you might want to reach out to another researcher in the field who has expertise. You can collaborate with your mentor, as well as attending. When you attend conferences, you might hear someone give a presentation, and then you might develop a relationship with them at a whole nother university or in a different country to help build out your research team. Do not be shy or reluctant to reach out to an expert and to offer them opportunity to collaborate together. Now, we have done a lot with our planning. Now is the time to actually think about our application. Do your homework. Get feedback on your ideas very early on. I talk with a lot of faculty and junior investigators and students who sit and write and work on their own for weeks and weeks and weeks and weeks, come to me with a 30-page document or what they think is a completed application, and they are completely off track. Or the methods that they are proposing are not a good fit for the research question, or there's some other problem within the application. Now that investigator is discouraged. They have spent a lot of time working in an area, and they may miss the application deadline because they have to redirect. So it's very important to talk about your grant ideas with your research teams, your mentors, or other experts to make sure that you are on the right track. It is also best practices to, if a colleague has a funded application, to share that successful application with other faculty members. They will not conduct the exact same study, but now they have an opportunity to learn, how do I set up the application? How do I describe certain things? What is an example of a successful application? And this is one of the ways in which the Office of Research Facilitation can help many researchers by collecting examples of successfully funded applications, so that if people who are working on submitting to that same funding area or to doing similar type of research, that they can have guidelines and a template for what type of application is successful. Because you will learn over time that there is a real consistent template for conveying your information. And we'll talk about that a little bit, perhaps in another lecture. So sharing your successful applications is key to your personal success, as well as the success of your entire unit and your research team. Okay. When you get feedback on your thinking, it is best to start with a one-page summary of your plans. That's usually called the specific aims page. You want to get feedback from your mentors, your research team, your advisors, as well as the program staff of the granting agency. Many grant agencies will have staff who are willing to provide you preliminary feedback on your one-page summary. Feedback not to the level of, yes, we will definitely fund this, but is this question or this area of research a good fit for our funding area? Also, it might be a good fit within their mission, but over the last 1 to 2 years, they may have gotten very many proposals that are looking at the same type of questions as what you're proposing, and they may no longer be interested in funding that. So they want to also diversify their portfolio. So it's a good idea to say, is this a good fit for your mission? And are you still interested in this type of research question? And oftentimes they will be quite good at saying yes or no. And they will often recommend another organization or another department within their funding agency that might be a better fit. So don't be shy about sending your one-page specific aims to the granting organization. Most will respond, not all, but most will respond. So how do you go about then getting your ideas on paper to develop the specific aims and to develop the initial draft of your application? One of the things that I recommend, and I provided a prior lecture on, is to use the project mapping tool. The project mapping tool was based on the NIH criteria for successful applications and the nursing research textbooks that help us to identify rigorous the issues in research that allow for the most rigorous study designs and the most valid and trustworthy results. So this project mapping tool is publicly available, and I recommend this as a way of thinking about mapping out your proposal so that you can talk with, in a very brief format, you can talk with your research team and advisors, get questions about your plans, and to be able to get feedback on any potential areas that are need to be additionally covered or need to be revised and refined. Okay. Now, finally, we are at the writing stage, but I want to emphasize that the writing is the least, it's important, but is the least important aspect of your application. What do I mean? If you write an application beautifully, it's in best English or best Thai, the no grammatical mistakes, high quality writing, that is insufficient to be funded. Why? Because who will be funded is based on the approach. So a strong approach with weak writing will be more likely to be funded than a very, very beautifully written application with weak message approaches and methodology. So what we say is that good writing is necessary, but not sufficient for a successful grant. It's necessary because it helps the reviewers to understand what you're proposing to do, but writing alone is not sufficient. It's about your approach. So when we write our grant application, as I mentioned, there's a very specific template that we use. And you will recognize this because it's the same template is also used for scientific research publications. So it includes your specific aims, typically your abstract. Specific aims is almost the same as the abstract for a grant application. The background and significance is like the introduction. On your preliminary studies, your research design and methods, and then your timeline. All applications have each of these main sections that need to be addressed. So let's start with the specific aims. The specific aims is one of the most important aspects of your study. Why? Because the specific aims is typically what's used by your mentors and advisors to understand what you're interested in studying. The specific aims is typically what is sent to the funding agency to get initial feedback on whether or not your study is a good fit for the funding agency. And it's the first thing that the review committee looks like when they are evaluating your proposal. And as someone who has had a lot of experience with writing research proposals as well as reviewing research proposals, a lot of decisions are made on writing specific aims. When I was first a junior faculty member, and I was receiving my training at the University of Illinois at Chicago at UIC, my senior faculty made me rewrite and rewrite and rewrite again my specific aims pages up to 5, 6, 10 times. That is the level of importance of the specific aims, because the specific aims becomes the roadmap for all the rest of your applications. The specific aims summarizes quickly the problem, the quick summary of the and synthesis of the available research. It identifies the gap in the research, the theoretical approaches or the key construct that you will include, and your research question, your specific research objectives, and the impact of the study if you're successful. All that information has to be conveyed in a very clear, succinct, and logical way within one page. So that is why there is so much attention and so much revision that is made. So that's my experience from the writing standpoint. Multiple iterations and a lot of feedback. Makes me want to die, but is necessary. The second experience with the specific aims is my experience as a reviewer. And I can say to you truthfully that the vast majorities of reviewers will already have made a decision about the quality of your research proposal based on that one-page specific aims. They will have decided, and based on the one page, if they think this is a high quality, exciting, innovative, and important study. Now they are very much predisposed to be positive about the study, and they will look at the rest of the application to verify, yes, their initial impression was correct. So they are looking at it from your specific aims very favorably. They're looking for evidence of mistakes, but they are looking from a positive standpoint. No. On the other hand, I have had the experience of looking at a specific aims, and I have grave questions, serious questions about the approach, the impact, and the research questions and the qualifications of the team. Now I'm looking at a very critical eye. My initial assumption is that this is a low quality application, and now I'm looking for evidence to support that this is indeed a low quality application. It's human nature. Our first impressions when we meet a person on the street, in the classroom, or through their ideas is that we right away inform opinions of that person. grant writing and grant reviewing is a human process. So it's important for us to understand the psychology of a reviewer when we're thinking about our applications. The specific aims is your first introduction, that reviewer's first introduction to you as a researcher, your ideas, and your research team. So you want that to be the strongest introduction possible. Now, it also happens, and you will hear a lot from the review committee, is that my first impression of this proposal was extremely strong. I wanted to like this project. However, I found these methodological problems. That's okay, because the reviewer is saying this is an important area, this is significant, but there are some issues that need to be addressed before I can be fully supportive of funding this application. And in their remarks, they will give you a roadmap to what to fix. But if they are positively inclined, that is half the battle. You've convinced them already that you're interested in something important. Now you just need to improve the rigor of your approaches. Okay, so this specific aims, I cannot emphasize enough the importance. So what is the template for the specific aims? It covers these 5 areas, and typically in this format. The first paragraph is to clearly say what is the problem and the significance of the health problem that you are focused on. So every research specific aims page, the first sentence or the first several sentences should be describing the problem and the significance of that problem. So for example, I would say cardiovascular disease is the leading cause of morbidity and mortality in Thailand. And after that, I would provide information about the prevalence, this and the death rates or associated with that problem area. So it clearly tells the reviewer what problem that you're focusing on, and you right away give them, using data, national or international data, about the significance of that problem. I next synthesize the literature in how I am interested in approaching this problem in terms of whether or not I'm interested in prevention, early detection, treatment, or looking at addressing issues of treatment outcomes and quality of life. So that succinct review is not describing everything that you know about the literature as it relates to cardiovascular disease, but where you will be focusing your program of research. Within that synthesis of the relevant literature, you will be saying what is already known, what is not known, or what are the limitations of the research, and what is the important research gap that your study will be addressing. The next paragraph will be focused on either the theoretical approach that you will be using that will specifically guide your research processes, the key construct that you will be using, or a description of preliminary studies that you or your team members have conducted that provides some supporting evidence that this is an appropriate pathway for further research. And then the final paragraph includes your specific aims or research questions, your hypothesis, if appropriate, and more recently, we are being asked to add a brief statement of the impact of our research in our specific aims page. So the impact is usually a brief statement that says, if successful, how will our research findings relate to either better understanding our problem area or improving outcomes associated with our problem area. So describing, addressing key informational gaps, descriptive information, or key intervention approaches. All that needs to be covered in the specific aims page. The next thing that you write in the application is background and significance. That's like the introduction section for your manuscript. It says in more detail, describes the problem and the statistics that you're focusing on. And it summarizes, again, in more detail, the synthesizes the research, the relevant research in that area, the limitations of that area, the gap that the literature that you will address, and any new approaches that you will be using that help to overcome gaps in the prior literature or weaknesses in the prior literature. So a point of innovation may not be, again, the use of technology, but it may be that you have synthesized the literature, or there's been a systematic review or a meta-analysis that points out key weaknesses in an area of research. So what do I mean? So in an area of research related to health promotion related to diabetes prevention, all of the outcomes may have been based on self-report. We know that there is bias associated with self-reports. Some people inflate the progress or overestimate or over-report the progress that they have made. And that is an important source of bias that keeps us from truly understanding the impact of the intervention on results. So you may have developed a means for better monitoring physical activity, better monitoring objectively medication adherence, or have developed another behavioral or clinical biomarker that helps you to evaluate changes in degree and disease progression. That is a better objective outcome measure than has been previously used. So in reviewing the literature, in the prior literature, one of the important things is to critique the limitations and to inform the reader of the gap and how your approaches will improve on the prior literature. Another important aspect of your talking about the background and significance is to use graphs or tables to illustrate the importance or the significance of your problem. Remember, this grant review is a human process. That means grant reviewers will have a lot of competing demands. They may not be careful readers. They might be new to your area, and they will likely have 10 to 12 other applications that they are also reviewing. So anything that you can do to help them absorb information in your application is positive. So I can spend a whole page talking about differences in smoking in the United States based on race, ethnicity, or I can write a briefer synthesis and show them this graph to where it's very clear what are the overall prevalence rates and what groups are at highest risk for current smokers. That, boom, is very efficient, and it helps the reviewer to understand the significance of your research question or the focus of your populations. So don't underestimate the importance of figures and graphs for helping convey key information when you're writing your proposal. Okay. I'll stop briefly here. I've been talking. You have been a quiet audience. Any questions or comments at this point? Please feel free to come off mute, write it in the chat, use Thai language. It's okay.
มีคำถามไหมครับหรือมีตรงไหนที่อยากให้อาจารย์อธิบายเพิ่มเติมสามารถบอกได้นะครับภาษาไทยก็ได้ครับเดี๋ยวผมจะช่วยแปลให้ If you have any questions please feel free to leave it in the chat box or just turn on your microphone and then you can speak either in Thai or English so we can help you to translate about that.
Mhm. Yeah. So again, my primary goal is to help increase your awareness of some of the process and some of the key issues. So please feel free. If this is new information, please ask questions so that I can clarify for you. All right. So what are some of the common mistakes that we see in that first section on background and significance? It's first the failure to document why the problem is important, either because it's a very prevalent problem or there's a high, meaning a lot of people in the population are experiencing this problem. Either there's a high rates of comorbidity associated with the problem, such as obesity. There's high rates of mortality, death associated with it, or there's a lot of strain on the healthcare system. Uh-oh. That one. Okay, we are back. All right. So what are some of the common problems that we see in the background and significance section? Failure to document very clearly why the problem is important. It's not enough just to say this is an important problem area. You must support that with evidence. And as I was mentioning earlier, the key type of evidence that we use is prevalence, how often, if there is evidence of health disparities or populations who are at additional risk, mortality, other diseases or amount of disease that is focused, that's associated with, and death rates, and then cost. You may not have all access to that information for your home country, but you can use WHO statistics to help support from a global context, and then include what is known from your own country in your applications. The next thing is the failure to really synthesize what is known about the area and to obtain the gaps, and then really describe the theoretical or scientific premise that is guiding your work. We talked earlier in one of my former lectures about the scientific premise. The scientific premise is either established by the research literature and findings that point to a known relationship between key variables that you're interested in and the outcome, or the scientific premise is established by an established theoretical framework that identifies what key variables are associated, or constructs that are associated with the outcome, and then the pathways in which how those constructs impact the outcome. And then finally is the importance of citing key studies and trying to keep in mind that you want to cite the most current literature within the past 5 years. Now, your theory citation may be older, no problem. Or if there is if there's an important paper about the methodology, that's okay if it's older, but information about the prevalence, morbidity, mortality, and the evidence associated with your approach should be based on the most current research within the last 5 years. Okay. The next section is the theoretical framework. Again, this is one of the ways all studies need to have a theoretical or conceptual framework. Whether or not you're specifically testing this theory or using a key construct from that theory, or you're and preliminary research is being guided by the need to try to understand in your population some of the constructs that are associated with the theory. So theory is guiding, or informing, or testing. Okay. So when we look at the study conceptual framework, you want to do a couple of things. Again, we want to help the reviewer. We want to provide them with a picture that describes, in addition to words, picture that describes your conceptual framework. Where possible, put lines indicating which aims the pathways are that you'll be testing. And where possible, again, you might want to include examples of the measures that you will use in your study to measure these key concepts. So instead of just only having decision conflict, I might have decision conflict and one or two bullet points of how I specifically will measure that in my study. This is important because we want to have a measures table and study measures section in your application that completely maps onto your conceptual framework. So in your study measures table, you want to identify in one column the construct, in the second column the information about what specific measures will be used to measure that construct. What did I do with my glasses? Hold on. I forget I need glasses. And any psychometric information, such as the number of items and the reliability and validity. And then the final category is the reference, so that the reviewer can quickly see, yep, here's the theory, yep, here's how they're measuring that construct. And if they're interested, they can look at the reference that you provided to see that, yes, indeed, this is a validated instrument and has been used in similar types of research. You might think that that's not so important, but this is one of the key things that I learned from senior leadership researchers at UIC. When I was junior faculty, I did not learn this prior in my training, but again, it helps to clarify very, very carefully issues related to measurement reliability, validity, and how these measures relate to my theoretical framework. So excellent best practice in terms of grant application. In addition, after the background and significance, you write your theory, and then you list preliminary studies. Preliminary studies is one of the first thing that you talk about as you describe your methods and approach. Here is that you want to demonstrate your expertise in conducting the research or key findings from your own research or another team members that provides the scientific premise to support the approaches or research questions that you're answering. Also, it shows that the team members have collaborated well together and that someone has expertise in each of the areas. So again, we want to make it very easy for the reviewer to understand the research team and our preliminary studies. So again, here's a best practice type of table that can be used to summarize the research team, the role that they will play, their area of expertise, their discipline that they come from, because some grant mechanisms require a multidisciplinary team. And then one additional column that I recommend that is not listed here is what aim of the study that person will be involved in, okay? Or what role on the study that they will be performing. Okay. Additional under the again, so preliminary studies is the first section in your approach. It describes your research team, and then evidence of prior work that you have done in this area. So this is showing if a part of this grant was to show that we know how to culturally target interventions, materials for low literacy populations. And so I describe here findings from another study in which we targeted materials for a low literacy population. It was a different population for a different study, but one, it shows I have prior experience. Two, it shows that that the targeted version was had better outcomes than the non-targeted versions. And so again, it shows both the scientific premise as well as my skill and ability and my prior work in this area. It increases the reviewer's sense of feasibility. Can this work be done by this investigative team? Again, some of our preliminary studies will talk about publications that team members have done together. And finally, if you are working with a community organization or you have a lot of community engagement, it is becoming quite common now, especially in research that's looking at health disparity populations, to have a community advisory board. These individuals are people who have worked very closely with the target population or on the target issue that are not necessarily academics or in your nursing discipline, but they have a lot of knowledge about the problem in specific communities. And they are brought on to help to advise you in how to recruit, whether to make sure you do ethical work, to make sure that your approaches are culturally appropriate or sensitive to the target population. That is also something that is very well received. The next section related to your approach is the design and methods. And here is where you need to do your best work. You need to describe what is your study design, your intervention or your data collection methods, how you will recruit, how many people you will recruit, who are you looking to recruit, inclusion, exclusion criteria, what are some of your what are your measures for the study, and keeping in mind the key independent and dependent variables, as well as a summary of all the measures as it relates to your theory, like we talked before. A section that describes your power analysis and your data analysis team, your data analysis plan. What will get you what will result in a poor score? Poor methods, lack of feasibility and lack of confidence in your ability to recruit the target population. And so you have to have clear recruitment team or strategies that have been proven effective and how to recruit them. You need to be very clear about using evidence-based and validated independent and dependent variables, deciding if indeed you needed a self-report or objective measure. If an objective measure is available and is considered to be the gold standard and you do not use that objective measure, you will automatically get a low score. If you have not included a power calculation or sample size estimates, you will automatically get a low score. If you do not have a biostatistician on your team who helps to create your data analysis plan step by step by step, and if there are too few details and only a very generic or general description of how you will analyze the data, you will get a very poor score. So in your data analysis plan, the best practice is to separate your data analysis plan by specific aim. Specific aim, sample size calculation. Specific aim, here are the analytic approaches that we will use to answer that question. Then you go to specific aim 2 and aim 3, right? Each aim has its own clearly detailed data analysis plan. This is key, and it must have a power sample size calculation. If you're focusing on a qualitative research, again, these same rigorous ways of describing what your design and your methods are need to be here as well, but you use ways of establishing rigor, trustworthiness, validation, credibility, et cetera, that are specific to qualitative measures, qualitative research, including when we think about our sample size. For qualitative studies, you don't perform a standardized power analysis per se, but you do have a section on your sample size looking at recommendations from textbooks, looking at citing research studies that have looked at several other similar questions and their samples, but really emphasizing the key point of saturation and how you will recruit until you achieve saturation, and how will you evaluate that you have actually achieved saturation. So even though it's qualitative, you must address each of these questions as well. Okay. When we're thinking about our design, again, pictures are very critical for that. It allows me to the reviewer to look very easily and say, okay, all right, yes, they're randomizing. They're going to have 3 assessment time points, pre-test, post-test at 3 months. The intervention group will have telehealth. I'll have to look at the procedures for that. And the control group will have the standard of care. I'll have to look at the details. But I understand by simply looking at the picture, big picture. This is a randomized control trial, 2 arms with pre-test, post-test, and follow-up assessment, comparing a telehealth intervention with standard of care. Okay, now I understand very quickly. You can also, you can also use a study design that if it's a mixed method approach, you can also put together a study design image that helps the reader to understand what you will do at each phase of the study. So in this study, phase 1 was qualitative design. I said how long it was going to take, how many groups, how many participants, what the eligibility criteria were. The second phase is that I look at adaptation, what procedures, and then finally I do a pilot test. So then this is a much more complicated design, and right away it tells the reviewer, this is a mixed method approach. Without reading anything else, I can learn this from looking at this picture. Mixed method approaches, it has 3 key phases. One is qualitative, one is adaptation, tool development, and the second is a randomized trial looking at comparing outcomes. Okay. So picture is worth 1,000 words. All right. Study timeline is also important, and you want the timeline to match onto your study design. So here you can see, if you look carefully, that I have months 1 to 4, what I was doing here, and then it lines up with my study timeline. So typically you want to do pre-grant application, pre-grant activities such as IRB, hiring, engagement with your advisory board, and then you go through and say, when will each of the phases of the study be conducted? What will the reviewers be looking for? Again, it tells them what your key tasks are associated with your project, and it helps them to make a decision whether or not they think that you have enough time allocated to do the work. Feasibility in terms of being able to do this work in the time allotted is something that you need to demonstrate to the reviewers as well. So timelines are good for that. I don't know why it gets stuck. Okay, so now writing the application, some things to keep in mind. First is to know your reviewers. This is an example of what it looks like in person. It is crazy. There are lots of people. They're looking at a lot of applications. They're making a lot of decisions. There will be some level of scientific expertise, but there may not be exact expertise in your area. So you want to make sure you're defining all your key concepts. Don't use jargon and assume that the reviewer does not know your field. And so you might say quality, we'll use a standardized measure of quality of life. And if someone is in your area, they might know what that is. But you would say quality of life is this. You would define quality of life. You will identify that there are standardized measures, and then you will report on what that standardized measure is. So that's a way of not assuming too much prior knowledge of your reviewer. The other thing is that you want to make it easy for the reviewer to read and to understand. Simple language, clear language, use of tables and figures to illustrate key points. Also, use of underlining and bolding of key concepts, but not too much. Some people, you look at an application and about every line is bolded or highlighted. That becomes meaningless. So key things that you want to make sure that the reviewer sees, you might some way want to bold or highlight or emphasize that information. And then also a key thing is to think about innovation. It's important to describe specifically the innovation in your study. It's not enough to say no prior research has been conducted in Thailand. That is not sufficient justification, and it does not demonstrate innovation. What you can say is that there has been this is a substantial problem globally. There has been tremendous amount of work that has been conducted in this area related to self-management, and there are many appropriate interventions that have been developed. However, in Thailand, there are key cultural differences related to the role of the individual in terms of management of their own disease that need to be taken into consideration as we adapt existing evidence-based self-management interventions. So because of these cultural differences, because of the burden of the disease, and because of the need to develop effective interventions, we are proposing the study to do X, Y, and Z. So in essence, you have said this work hasn't been done in Thailand, but you provided a rationale for why we might think this work would be different. And again, it's not enough to say different cultural context. You have to identify what are the cultural beliefs or the differences in the healthcare setting or resources that would necessitate a new study in your talk or additional work that's specific to your country. Okay. So what are the reviewers looking for? Sorry, I don't know. I don't know why I stuck. Maybe maybe is tired of listening to me talk. All right, what was I talking about? So you can see that many different reviewers will have different opinions. There are 3 people who are assigned to each review, to each application, a primary, a secondary, and a tertiary. The primary is reviewer's job is to provide a description of the application to the entire group, and to highlight key strengths and weaknesses. The secondary and the third reviewers either agree, add new information about strengths or weaknesses, or disagree with what the prior reviewer has said. And so again, you can sometimes get review summaries that are a little bit confusing because the committee had differing opinions. And that's to be expected. So you really want to help your application and help the reviewers like your work by proposing a strong idea, significant, innovative, have a strong science that you're proposing, and a strong application. Keeping in mind that the reviewers will be looking at 5 review criteria: the significance, the approach, your innovation, the investigator team, and then the environment. Each of these are evaluated individually, and meaning that significance will receive a score, approach will receive a score, etc. And then each of this information is combined for a total impact score. But there's something that's important to keep in mind, is that it is not an average of all of these scores that determines your total impact score. So you may have gotten a 1, a perfect score on the investigator, a perfect score on the environment, and then lower scores on significance, approach, and innovation. Your overall impact score will be much closer to the lower scores than the higher scores. Why? Because there was a study that has been conducted to look at what criterion of these 5 is most strongly associated with your final impact score. The final impact score ranges from 1 to 9. The lower the score, the better. Scores that are rated 1 or 2, and sometimes 3, have a very, very, very good chance of being funded. Scores that are lower in the medium impact range, 4, 5, and 6, there is some interest in the application, but there are weaknesses that need to be addressed. Low impact 7, 8, 9 means the problem was not seen as significant, it was not innovative, and there were many, 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 many weaknesses. So as a first time when you're submitting your application, I tell this junior faculty that your goal is to try to get a 4, meaning that they have a 4 or a 5, that they like the idea, they understand the significance. You have tried to put the most rigorous application together as possible, but they have identified some weaknesses that they will tell you about, and then all you need to do is to address those weaknesses in a resubmission. It does not necessarily guarantee that you will be funded, but it gives you a good opportunity. Now, let's think about what section is most strongly correlated with impact score. As you can see, the higher whatever the impact score is, it is extremely associated with approach. So the approach is 6.7 times more likely to be predicting the impact score compared to significance, innovation, and investigator. All right. So you don't too much have to worry about that you're a newer investigator, right? It's okay to be a newer investigator, but you have to have a strong team so that it counts, but it's not the main driver. The main driver is approach, and it is all about your quality. Okay. So they look at each of these criteria. Significance. Does it address an important problem? And does it advance scientific knowledge? That's what we're being asked to evaluate under significance. The second criteria is the investigator. Are the investigators well trained, and do they have the experience to conduct every aspect of the study? And we've talked about the need for a content, methodological, statistical community, and a clinical expert. Innovation. Again, are the aims original, innovative, meaning novel methods, measurements, data collection approaches, or theories? Or does it challenge an existing theory or a way of doing something? That also counts as innovative. The approach, again, this is the most critical area, and this is evaluated very, very rigorously. And then finally, the environment and the importance of letters of support. Okay, so get feedback on your application as you're developing it. Try to use critical appraisal tools to help guide you in terms of the methodological strengths for the design and methods that you will be using. Try to address each of those in the application so that it helps the reviewers see the strengths and the appropriateness of your strategies. Where possible, cite articles, other studies that have established the measure as the gold standard, or the approach as evidence-based, or the analytical approach as appropriate for answering these types of questions. Cite the literature that provides evidence of what you're doing as being evidence-based. Okay. So, last section, what determines what applications will be funded? The first is the scientific merit of the application. Again, depending on the approach used. Is this the strongest application? So if they have 50 applications, they will usually fund the top 10%, right? So merit, the strongest applications based on scores. Program considerations, meaning the fit with the mission and whether or not they have you're within their mission, but you're actually addressing a part of their portfolio that they haven't gotten a lot of applications for recently. And so they might select your score, even though it might be slower, a little lower in impact, because it addresses an important programmatic consideration. And then finally, how much money they have to give away. So grant writing is difficult business, right? The success rate is very low, but the primary determining factor is whether or not you will eventually get a grant is persistence. If you don't apply, you can't be funded. If you do not learn, if you do not receive training and support from your senior colleagues, other experts, or your mentor, the odds are you will have a weaker application. And then even if everything is perfect, you still may not get a fundable score and you have to resubmit. So failure is the norm. I have had lots of studies that have been rejected and not funded, and less that have been funded. But each time I submit an application, each time I review a study, each time I'm asked to consult, I learn something new about how to put together a great proposal. And again, before starting, ask a colleague, do you have an example of a grant that you've written that's been successful that I could observe, that I could use? Revising and resubmitting, the thing that you can hope for the most. I have only known one person in my whole entire life, and I'm old, in my whole entire academic life, and I'm old now, that has gotten a perfect score and who was funded on the first attempt. Well, one person. She is now the director of the National Institute of Nursing Research, Shannon Zink. So that tells you how famous she is. She deserves it. But most of us are not that skilled. So we benefit. It's the reviewer's job to tell you what's right and what's wrong with your proposal. And it's your job to revise the proposal so that you address each and every one of the primary concerns or the primary critiques. If you cannot address it, you cannot just ignore it. You may disagree, but if you choose not to make the change that that the reviewers recommend, you have to provide a strong scientific rationale and provide many citations that suggest that your approach is a reasonable approach to take. And even then, sometimes they will back down, but sometimes not. When we see a revised application, and this will be my last point. Sorry about the going over time. When they receive a revised application, the first thing the primary reviewer says is that this is a revised application from investigator XYZ. They have been strongly responsive to prior reviews. They have been moderately responsive to prior reviews, or they have been non-responsive to prior reviews. You do not want to give them an opportunity to say non-responsive or moderately responsive. You want to hear them say they have been highly responsive to prior reviews, meaning you have taken the feedback and you have addressed it point by point by point, either to clarify, to fix, or to provide a rationale. Okay. Any questions? I appreciate your listening and your involvement, but please, we can maybe take a couple of questions if you're able to stay.
มีข้อคำถามไหมครับจากทางผู้ฟังทางบ้านครับ Do you have any questions for those who attend online? Please feel free to share that. If no question, you can share your experience on how what did you do for grant application in the past or your publications. Okay, I think I have few questions.
Okay.
Due to the grant applications, Dr. Matthew tried to say about the rigorous method. And for those of our faculty member who interested in qualitative study, do you think to apply the grants with the qualitative project, is it possible to get that?
Yes, it is possible, but you have to look at the funding agency and to look at what the mission is, and then look to see what studies they have funded in the past. If they have everything is large, multi-site, randomized clinical trial, you know that your application using a qualitative approach will not likely be very successful. But there are other foundations or organizations like the Robert Wood Johnson Foundation, which is a large nonprofit health research funder in the United States, non-governmental. They are very much okay with qualitative approaches, and you can see that. So that's a part of your planning and your homework to make sure you know which funders are willing to consider qualitative approaches. That being said, all the things that we've been talking about in terms of the establishment and demonstration of significance, understanding the gaps, and the methodological rigor also apply for qualitative research.
Thank you so much. Dr. Bunja, I see you turn on the camera. Do you have any questions?
Okay, thank you very much for your lecture, Professor Dr. Matthew. Okay, I gain a lot of knowledge from your for attending your lecture. Yeah. But I have one question about the submit the manuscript. Okay. If the manuscript had been submitted for a long time, maybe 4 or 5 months, but uh, uh, but uh, but had not yet received a response from the editor, how should I do? Thank you.
Oh, okay, good question. It is perfectly fine to email the editor and say, I'm writing to check on the status of my manuscript. Here is the title, here is the manuscript reference number, and here is the date in which it was submitted. That information will help the editor quickly identify your paper. Your name, title, manuscript number, date of submission. That will help them to identify very quickly. And they will typically cue them to say, what's going on with this paper? And what is typically the problem is that we're having problems now finding enough reviewers and getting the reviewers to complete their review in a timely fashion. And so sometimes they will say, oh, we had a bit of a delay in finding reviewers. We hopefully in the next several weeks, or something like that. But it is perfectly fine to notify the editor, the managing editor, and let them know that it's been quite a long time. They still may ignore, but often if you bug them about once a month, they will be responsive.
Okay. Okay. If I submitted the manuscript to another journal without waiting for from response from the editor, should I do or not?
Ooh, no, 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 no. It
No.
before,
Okay.
no. Before submitting to another journal, you must formally withdraw your submission to the first journal, because we sign an agreement to say that this work is not under review or being considered at any other journal. And you may tell the editor that it has been quite a long time and I'm planning to withdraw my submission unless you can give me a reasonable estimate of when I should expect my feedback. And I have done that. I have withdrawn. But typically after 5 months, if they say, we're just waiting on one more review, I will talk with them. It's usually best to leave it there, because then you'll run the risk of having the same process happen with another journal. But yes, submitting the same manuscript to multiple journals simultaneously is considered a problem.
Okay. Thank you very much, Professor Dr. Matthew.
You're welcome. You're welcome. I think I saw something show in the chat.
Yes, some of our faculty member would like to know that you mentioned that if the gaps of research, it seems like if there is no research in Thailand, it doesn't mean it is not equal to the innovation, right?
No.
Yeah. So she want to know because in Thailand they have like a different context environment, which is different from other country. This can be a reason,
Yes.
for specify in that part or not?
Yes. But it has you need to be very careful and not just say, well, we're different cultural contexts. You have to link the known cultural differences to elements of the intervention, or to elements of the way that we conceptualize a problem, in order to justify the importance of replicating or continuing the work in your own country. Now, if you're going to a national funder, your government in Thailand, it's completely reasonable to say, this work is under-examined, this topic is under-researched in our country, here's what I want to do and why. It's never been done before. That is actually a positive thing, right? It shows that you're addressing a clear gap in knowledge. But if you want to go to an international funder, it is not sufficient to say, in the global community, we have all this research, but we haven't done it in Thailand, so we're just going to replicate. That will not be, that in and of itself will not be well received. But if you provide clear justification, then it's okay. So you want to talk about the minority stress. For your research, there's a lot of been focused on minority stress in other countries, but not evaluated here. And there are some cultural differences that may have implications in your research about that.
Yeah, based on my area of research, I focus on minority stress, especially among LGBT populations. And most of the problem that we have, we do not have this research much in Thailand. But in terms of we do not have any research, I try to explain how is it create the barriers of research, how is prevent our researcher to have a standard measure, understand the contextual of LGBT definition about the concept of LGBT. So I try to specify those reasons and make it elevate the reason to make it more important to get the fund or publication in terms of that the area of this research.
And his research, even though every single last piece of it has been focused on the Thai context, he has embedded and he has framed his work within an international model and evaluating new questions here in this context, clearly showing leadership in the development of a program of research, and it has been accepted in the international literature Q1. So it is possible if done in if the strong rationale for why the research and then is important in this context. And then here's the second objective. Then you must refer back to the global literature, the international literature. So you say, here's what's happening on the international stage. Here is our population here. There are some things that are likely the same, but there are many things that are likely different. We're going to understand that. And then we compare our results to the global literature. That, I think, is another way of making national or country-specific data relevant to a global problem and a global community of researchers. And Periot's, his research has been primarily used to guide surrounding other Asian countries where there is still the same issue of lack of methods, lack of theoretical frameworks, and lack of measurement instruments. So each of you could play really, really important roles in your own country, in the region, as well as the international literature, but it must be framed appropriately. It is not enough to say, we don't have it, we've never been doing it before, so we're going to do it here. Well, funding from probably government or your institution, but not relevant for international or for Q1 journals. And that's just the reality. I was working with a student from Pakistan just recently on a systematic review on scoping review for smoking risk factors among adolescents in Pakistan. And I suggest to him, your focus is on risk factors for a target population in Pakistan. The audience is Pakistani researchers and clinicians and educators. You should use a domestic journal. No, Q1 international. So I say, okay. He submit to Q1 international and they say, this is not relevant. This is relevant to your country. This is good work, relevant to your country. Send it to a domestic journal. And now he has, and it's now currently under review. So it does not mean that they think that the international journals think the quality is not good necessarily, but it means that the research does not necessarily have generalizability to other countries or to the global context. And so that's something else that you have to think about in terms of your framing if you want to go to international, as well as how to talk about the relevance and the implication, not just for your country, but for international context. That's the key to the discussion. Link it to the international problem. You might focus on Thailand as a specific example of this international problem and how the results have implications for the international audience. That is key to publishing in an international journal.
Thank you so much. I think you have any questions so far? If not, I would like to say thank you so much to Professor Dr. Alicia K. Matthews to give us the overview of idea, how we can prepare the project to apply for the grant application, and also for those who have a desire to publish their work in the high-ranking journal, right? So every piece in the research is important and is a key if you prepare well based on the thing that Dr. Matthews recommend. So I think we can get a high achievement on those things that we want. So finally, before we leave or finish this session, I would like to ask every one of you to turn on the camera. We would like to have a beautiful picture together. We want to capture you in this same screen. Okay, please turn on your camera and we will take a photo together. Thank you. I see many turn on the camera with the big smile. Okay, keep smiling. I'm gonna count down. 3, 2, 1. One more. We need one more. Okay, 3, 2, 1. Thank you. Thank you. Have a nice day.
Okay.
Please stay tuned with our activities from Faculty of Nursing. We still have a lot of topics that Dr. Matthews is going to deliver for us to get our experiences next week. Please stay tuned. See you again next week. Bye-bye.
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 Okay,
Bye-bye.
thank you,
Thank you so much.
Professor Dr. Matthew. Thank you so much.
Thank you.
สวัสดีค่ะ
Rika.